On this Wednesday night, a highly anticipated approval.
This is a momentous occasion.
Health Canada greenlights the Pfizer-BioNTech COVID-19 vaccine.
The geek in me is amazed.
When will the first doses arrive and where will it go first? A bleak Christmas ahead for Alberta. COVID-19 cases are expected to overwhelm ICUs. Will new restrictions make any difference? The promise of relief and calls for help from a Manitoba First Nation in crisis. And the pandemic forces small businesses to think outside the box.
It's taking every kind of creative force we have to be able to keep the doors open.
The pursuit of profitability and positivity.
Global National with Donna Friesen.
Good evening and thanks for joining us. The first vaccine for COVID-19 will soon be on its way to Canada. Approval has been granted for the Pfizer-BioNTech vaccine, and the first injections could happen as early as Monday. For weeks, Health Canada scientists have been analyzing data from the Pfizer-BioNTech clinical trials, and it now concludes it meets the department's stringent safety, efficacy, and quality requirements for use in Canada. The first doses, 30,000, ship later this week from Belgium. By the end of December, 249,000 doses are expected, and by the end of March, 4 million. This makes Canada the third country in the world, behind the UK and Bahrain, to approve the Pfizer-BioNTech vaccine. The American Food and Drug Administration is expected to approve it tomorrow.
Can you just explain to us how you beat the FDA today?
Sure, we're just better. In a year where we haven't had a lot of good news, this is a bit of good news, and I think we should take a moment to acknowledge that, and then we're all going to get back to work.
Not everyone will get it right away. These first doses will go to 14 vaccination sites across the country. Most Canadians will have to be patient, and other vaccines are in the pipeline for approval too. David Akin has our top story on Canada's first dose of optimism.
This is a big deal, Mr. Speaker. It is a good news day for Canadians.
And now, with Health Canada's okay, the first Canadians will get their dose of the Pfizer-BioNTech vaccine within days.
We have not compromised in terms of the safety, efficacy, and quality. And then as soon as that review is done, we've done the authorization and we've communicated with everyone. And it just so happened we got the last piece of information late last night.
Health Canada had been waiting for the results of 2 clinical trials involving 44,000 people. And even though regulators used a new process to quickly review those trials, they say no corners have been cut.
It is a full review in the sense that we looked at the same type of data that we would normally when we look at any vaccine for authorization. And while Health Canada says the vaccine is safe, it also says there will likely be some minor side effects. In the trials, 84% reported a sore arm where the needle was given. 63% reported fatigue. Some also reported headache or chills. And about 14% ended up with a fever after the dose. So all of the reactions that we had seen were relatively mild, they were short-lived, and then they resolved. Now to get the vaccine into the arms of Canadians. The doses are made in Belgium. They will be flown on Friday to Germany via UPS, then onto a UPS depot in Kentucky, where the doses will be parceled out and flown to one of 14 vaccination centers across Canada, with first injections as early as Monday. Most provinces want those living in long-term care facilities to be first in line for the vaccine, but since many residents cannot come to a vaccination center, and since Pfizer does not recommend sending the vaccine out, well, something's going to have to give.
There's some very, I think, intense discussion and planning going on. For example, certainly the government of Quebec, for reasons I can fully understand, say they would like to have their first doses delivered in long-term care facilities. I think we can get that.
Up next, a full dress rehearsal on Friday for the more than 100 federal, provincial, First Nations and healthcare providers that will be the first to handle Canada's first COVID-19 vaccine. Donna?
Okay, David Akin in Ottawa, thanks. As Health Canada's Director of Medical Science said today, information is the best antidote to any fears of the vaccine. And you can find lots of detailed information and data about the approval process for vaccines and how the Pfizer-BioNTech vaccine works. That's on the Health Canada website. Lessons can be learned from the UK too, where thousands of people have already received the Pfizer-BioNTech vaccine. Some people have had mild short-term side effects like pain at the injection site and fatigue, which are not uncommon with vaccines. 2 people in the UK, both of them healthcare workers with histories of severe allergic reactions, did have an adverse reaction. They have both recovered, but UK regulators are advising people who have a history of severe allergies not to get the Pfizer-BioNTech shot. Canada is not going quite that far. Crystal Gamansing reports.
That's it, we're all done.
Day 2 of the rollout, and now fewer Britons may be able to get the Pfizer-BioNTech COVID-19 vaccine. In what's being called a precautionary move, anyone with a significant allergy to food, medicine, or vaccines and carries an EpiPen shouldn't get the shot.
Inevitably, you accrue more information over time.
The information in this case follows 2 National Health Service workers having adverse reactions. Both have a history of serious allergies.
We know from the very extensive clinical trials that this wasn't a feature, but if we need to strengthen our advice, now that we've had this experience in the vulnerable populations, the groups who've been selected as a priority, we get that advice to the field immediately.
Regulators also say the vaccine should only be given where resuscitation is available. Right now, hospitals are being used as vaccination sites, but it could limit more locations being added. Canadians will not see the same limitations. Instead, a breakdown of ingredients is being published on the government's website, and people are encouraged to review it. Dr. Mark Greenwald calls the changes in Britain ridiculous.
And that is not to protect the public. That's to protect the individual's position and the authorities' position to look good. They're warning you.
It's not known what type of reaction the workers had or if it was specifically caused by the vaccine, but they're said to be recovering. Meanwhile, the vaccine campaign continues, but with nurses asking patients about their allergy history before rolling up their sleeves. Crystal Gamansing, Global News, London.
Manitoba's premier expects nearly 2,000 doses to arrive there next week, enough to immunize roughly 900 people. Seniors, those working in the healthcare system and long-term care facilities, and Indigenous people will get the shot first. 18 more Manitobans died from COVID-19 today, the province's second highest daily death toll since the pandemic began, and 280 new cases were reported. In BC, more than 600 new cases were reported today and 16 more people died. BC's provincial health officer says vaccine doses are expected there within days, and the first to get vaccinated will be 4,000 frontline workers, those working in long-term care homes, emergency rooms, and ICUs. And next door in Alberta, nearly 4,000 vaccine doses will go to ICU doctors, nurses, respiratory therapists, and long-term care staff starting next Wednesday. Premier Jason Kenney is rejecting criticism he waited too long to impose tougher public health restrictions. Masks are now mandatory, indoor and outdoor social gatherings are banned, and bars and restaurants have to move to takeout and delivery only. As Heather Yurix West reports, the system is at the brink right now.
Edmonton's Royal Alexandra Hospital has become the epicenter of Alberta's fight against COVID-19. More than 100 COVID patients are being treated here.
It's a very sick group of patients who decompensate very quickly. I'm on tonight, and I will not stop moving because they can go from just requiring some oxygen to incredibly unwell very quickly.
Dr. Darren Markland is welcoming Alberta's new measures, but he says this should have happened weeks ago. The number of Albertans in hospital has already risen dramatically since the beginning of November, when 115 people were in hospital and 28 more in ICU. As of Tuesday, there were 542 in hospital, with 112 patients in intensive care. But according to internal Alberta Health Services modelling obtained by Global News, by Christmas Eve the number of COVID patients could rise to more than 1,000, with nearly 200 patients in ICU.
What we have seen are the people in intensive care now are likely the people that were exposed to virus 2 to 3 weeks ago when cases were about 1,000. And now we're closer to the 2,000 new cases a day mark. And these people will be the ICU admissions around Christmas time.
The Jason Kenney government has been heavily criticized for its delayed response, but the Premier is making no apologies.
So why didn't we do this earlier? Because we have sought to limit the damage on our broader society.
And in an interview on Edmonton's 630 CHED radio, the Premier repeatedly characterized criticism of his government's response as an affront to the entire province.
I know there's been a fair bit of Alberta bashing here, but Alberta has actually done, Albertans have done remarkably well through the COVID pandemic until the last few weeks.
That's classic Jason Kenney, right, is finding enemies. Much of the stronger criticism has actually come from within the province. It has come from doctors. It has come from mayors. It's come from the opposition. It's come from the academic community. It's come from the business community.
New measures won't bend the curve down overnight. The best hospitals can hope for is some relief in about 5 or 6 weeks' time. Heather Urix West, Global News, Calgary.
The crisis on a remote First Nation in Manitoba is a stark reminder vaccines are not here yet, and the virus is still spreading fast. More than 260 of the 1,300 people who live on the Shamattawa First Nation have now tested positive for COVID-19. It is a remote fly-in community. Living conditions are cramped, and the chief says his people need help. Mike LeCouture reports.
It seems that no one's listening, especially Justin Trudeau.
The feeling of being forgotten from a First Nations community in northern Manitoba. Sherry Schwader lives in Shamattawa, where 1 in 5 residents has COVID-19.
We do not have the supplies or the machines or the manpower to take on anything like if it gets really out of hand.
That's why Shamattawa's chief and other regional chiefs asked Prime Minister Justin Trudeau to send in the military and airlift elders out of the community. And it would seem there's been progress.
We've heard the call for more support, and an evacuation of vulnerable community members has already begun, with efforts underway to increase the isolation capacity within the community.
In a Facebook post, Shamattawa's chief, Eric Redhead, said military rangers are assisting the community. A spokesperson for Indigenous Services Minister Mark Miller tells Global News 48 people have been evacuated to Winnipeg. And that is key, considering many people in the remote community live in multi-generational homes with little room to self-isolate. Opposition MPs say the government should have been better prepared for this.
We've been saying for months that a worst-case scenario would be COVID hitting a fly-in First Nation with limited resources. That is Shamattawa.
Now, in addition to COVID-19, the community is also dealing with a tuberculosis outbreak, and the water treatment plant keeps breaking down, according to the Manitoba regional chief.
The Canadian Rangers have made that assessment and have indicated that the water treatment operator is currently being isolated out of the communities.
Just another blow to a community already dealing with so much. Mike LeCouture, Global News, Ottawa.
5 mink on a farm in British Columbia's Fraser Valley have tested positive for the coronavirus. The farm has been placed under a quarantine order. The facility hasn't been identified, but it's located east of Vancouver in the province's COVID hot zone. 8 workers there tested positive for the virus this weekend. Millions of mink have been culled in countries such as Denmark, Spain, and the Netherlands after a strain of the virus was passed from humans to mink, then back to humans. There are 60 mink farms in Canada. Officials do not believe a cull is necessary here at this point. The challenges of COVID-19 vaccine delivery and distrust. Coming up, the hurdles ahead in the U.S. Plus, new clues in the mysterious illness plaguing hundreds in India. The U.S. Food and Drug Administration is expected to approve the first COVID-19 vaccine in the U.S. tomorrow. Cases are surging all over that country, and more than 2,000 Americans are dying of the virus every day. Once a vaccine is approved, the challenge will be the logistics of delivering it and convincing enough Americans to take it. Jackson Prosco reports.
If there was ever a time when Americans needed something to hope for, it's now. On average, a COVID-19 patient dies every 30 seconds in the U.S. An internal White House report shows the rapid spread of the virus over the past 3 months. The entire country now reports staggering levels of new daily cases.
Things will be pretty dark. I think things will peak in January, and then we'll start getting better.
A vaccine is the light at the end of the tunnel, but there's a long way to go.
In the first few million doses, there will be minimal impact on transmission itself, because this is not just enough doses to break transmission.
The White House turned down an offer to buy more doses of the first out-of-the-gate Pfizer vaccine, preferring to hedge its bets on multiple different vaccines, some still in clinical trials.
We have contracts with 6 vaccine manufacturers that add up to options to buy up to 3 billion doses of vaccine.
It will be late spring or early summer by the time there are enough doses for every American. Even then, there's no guarantee people will take the shot. 55% of New York City firefighters surveyed said they would not get a vaccine. A study from UCLA found that 2/3 of healthcare workers, those first in line, want to delay getting vaccinated.
This was about this specific COVID-19 vaccine. And that has to do with the politicization of the process. That has to do with the speed at which these vaccines were developed.
In a bid to boost public confidence, 3 former presidents, Obama, Bush, and Clinton, are volunteering to be immunized on camera, while vaccine makers are distancing themselves from the current president, hoping to avoid any perception that they rushed their products to market for political purposes. With U.S. regulators expected to grant emergency use authorization to the Pfizer vaccine this week, the first doses could be coming within days. Just as in Canada, frontline healthcare workers are among the first priority as they deal with that crush of COVID-19 patients. Donna?
Jackson Prosco in Washington, thanks. Venice underwater again. Ahead, why didn't the billion-dollar flood barriers work? This wasn't supposed to happen again. St. Mark's Square in Venice is underwater once more. Heavy rains and a high tide led to this, and a massive $8 billion flood defense system meant to hold back the high tides was not activated. Authorities apparently didn't think the weather would be bad enough to cause this flooding. Just over a year ago, Venice experienced its worst flooding in more than 50 years. Officials in India believe they may have found the cause of a mysterious illness. Test results show traces of nickel and lead in a few blood samples taken from some of the patients. Since Saturday, more than 585 people in southern India have been hospitalized with an unidentified illness. Their symptoms range from loss of consciousness to nausea and anxiety. Experts are now working to determine the source of the heavy metals and how they got into the patient's blood. Farmers in South Africa are trying to save their crops from swarms of locusts. This is very 2020. Clouds of locusts have taken over part of the Northern Cape region. Fumigation is underway to try to eradicate them. In a single day, a swarm of locusts can devour enough food to feed 35,000 people. In January, parts of Eastern Africa were hit with one of the worst locust outbreaks in decades. Next, Canadians turning to creativity to try to stay in business. Curbside pickup and takeaway or delivery. There are ways to shop local in the pandemic, but a new survey by the Canadian Federation of Independent Business shows Canadians only plan to spend a third of their holiday budget at small local stores. Competing with the big guys means having to get creative, as Abigail Beeman explains.
This is great for people who wear silver.
When the pandemic closed the doors of her business, Kim Smiley opened a window.
A lot of people are talking about how they pivoted. I like to think of it more as pirouetting.
Her flagship store launched just weeks before Toronto's retail shutdown. It was supposed to house her jewelry, an art gallery, and be a space for workshops about empathy. So now she offers personalized window shopping sessions, door open or on the phone behind glass at the customer's preference.
I don't think we should give up on beauty. I think we should embrace beauty, and people are shopping because it's light, right? And people need light right now because there is so much darkness.
It's one thing to get it online and have it in a day. It's another thing to connect with people.
In Calgary, new restaurant restrictions were just announced. Deja vu for the owner of Modern Burger.
14,000 burgers over the closure, which was insane.
December is usually the most profitable month for restaurants, not 2020. Stephen Deere is focused on curbside and COVID-19 pricing, serving $7.95 burgers.
We've done many things to make sure that we're going to be around for a very long time. But speaking for the general climate in Calgary, it is the worst I've ever seen.
According to the Canadian Federation of Independent Businesses Recovery Dashboard, only 29% of small businesses have normal sales, but 43% of owners are working significantly more hours.
They're stressed both financially, and of course that feeds into emotional stress as well.
I'm definitely working in some capacity 7 days a week in order to stay afloat and adjust an online platform.
Heather Lee didn't expect to launch a website when she started her gardening business in March, but she built one herself. She now offers online workshops, much more delivery, and with no Christmas markets, she launched her own mini markets at coffee shops.
If I look at it as a blessing, rather a curse, I know that moving next year or the year after into business, that I do have all of these other items in my back pocket.
In a trying year, all these businesses trying to stay positive and creative. Abigail Beeman, Global News, Ottawa.
And that is Global National for this Wednesday. I'm Donna Friesen. 2020 has been grim in so many ways, but one thing that has thrived apparently is dating apps, and not just for humans. These lonely otters, who both lost their longtime partners, found love in lockdown. Pumpkin and Harris met on an otters-only dating app called Fishing for Love. They're now doing swimming lay. In fact, Harris has taken the big step of moving from his sanctuary in Cornwall, England, to Pumpkin's pool in Scarborough, where he will be her significant otter. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.